The National Pharmaceutical Council engaged the Benfield Group to do some research on consumer-directed health plans because consumer-directed health plans are becoming a pretty major part of the healthcare landscape right now. Employers are more often making these plans available to their employees and are implementing strategies to increase employee adoption of those plans once they're in place, including what they call full replacement, or making consumer-directed health plans the only plan option available to the employee. And they're doing this because, largely driven by the fact that through the Accountable Care Act in 2018, employers will be hit with what's become known as the Cadillac tax, or the excise tax on high-cost health plans. And so employers are highly motivated right now to take healthcare costs out of the system, if you will, or out of their budget, and lower them or control them so they don't get hit with this excise tax. And consumer-directed health plans are one way to do that, and do it pretty effectively and predictably. We had 5 major findings. One is that a standardized approach to implementing consumer-directed health plans has emerged. Secondly is that employers have become sort of passive with respect to how they manage prescription benefits within particularly HSA-based consumer-directed health plans. Third is that employers are actually pretty happy with major results that they're getting. However, the fourth finding is that there are concerns that have emerged that employers have about the impact of their plans on certain employees. And finally, and related to the fourth, is that some employers, having sort of seen those concerns, have begun to develop ways to, or innovate ways to implement a CDHP in a way that sort of addresses those concerns. What we learned is that the standard approach is generally going to be a health savings account. Very rare to see a health reimbursement arrangement being implemented these days. There is going to be preventive services are going to be covered to a great extent. There's going to be a lot of employee communications. There's going to be an effort to try to figure out where to set the deductible, how much to contribute to employee accounts, how to perhaps encourage employees to make their own contributions. And finally, one of the findings that kind of surprised us was that preventive drugs are now a common part of the standard CDHP approach, if you will. And that's good news. It wasn't true even 18 months ago, but now it's just part of how employers are being advised to implement CDHPs, and that's good news. However, the bad news is that employers are very passive about that preventive drug benefit. They're not looking at what's on the list. They're not challenging what's on the list. They're essentially being told the PBMs will make the lists. Sometimes the lists are very, very narrow, generics only, and other times they're broader. But the employers are being told, just go with what the PBM has on the list. Don't ask any questions, because if you start to meddle in what's on the list, you might find yourself with drugs on the list that shouldn't be on the list, and perhaps the federal government will come along and tax you for that. And as soon as the tax word comes up, you have corporate attorneys in the picture. And so really what happens is the dialogue that should exist between the employer and the PBM about what drugs they should cover for the health, productivity, and overall economic value of their health plan, that dialogue is ceasing to exist, because that PBM is determining the list, the employer is accepting it, no questions asked. Probably not a good thing. So when we looked at the data, we found a couple of other sort of contrasting findings. One is that employers are generally happy with 3 sort of high-level outcomes. They've reduced their costs, they've engaged their employees, and they've been able to sort of keep the negative noise level down of employees who might complain or be dissatisfied with the plans by how they engineer them and how they communicate them. So those are positive things. At the same time, we see more than half of employers are at least moderately concerned that low-income and low-salaried employees and employees with chronic conditions are going to be struggling with these, or are currently struggling with the plans they've put in place. And about half of employers are at least moderately concerned that employees are not getting the medical care that they need, and they're not adhering to prescription drugs the way they ought to. There are a few that I'll highlight. One would fall under the category of reducing the employee's deductible. some employers just decided to increase the deductible or their contribution to the HSA account, or to use incentives so employees can essentially earn additional dollars into their account by completing wellness risk appraisals and implementing or taking advantage of programs, screenings, etc. And then probably the most elegant and simple idea is for employees who are lower wage, you put more into their account than employees who are higher wage, because low wage employees tend not to have the cash needed to cover medical expenses in the short term. So put more money into their accounts. Very simple solution. Another thing that employers are doing is simply engaging that conversation with their PBM about what's on the preventive drug list, making sure that it fits with their strategy and frankly their philosophy about employee benefits and managing the health and well-being of their employees. And then I guess the last one I would highlight, and this is probably the most innovative thing that we heard in our interviews, was an employer that seeing that many of their low-wage employees were foregoing medical visits for the care of chronic conditions, they went out locally, contracted with a medical provider, and are paying the full cost of those medical visits, thereby reducing sort of the barrier to ongoing care for chronic conditions by taking the cost right out of it for the employee through direct contracting. I think the implications of this research are that employers are clearly moving down the consumer-directed healthcare path. Many of them have committed, completely to offering CDHPs as the only option, and others are moving in that direction, no doubt. And the question is, once you've realized those initial sort of benefits of lower your costs and you've got employees' attention and you haven't made employees too angry, the question is, what's next? What's the next strategy to make this not just a short-term cost reduction strategy, but a long-term value strategy? And I think if you look at some of the things that the leaders are doing and other things that will follow as we watch what employers are doing in this space, you can see things that are being done to make sure that employees who are perhaps most vulnerable aren't going to be left behind, and that the strategies can be honed in a way that can deliver total health and productivity value.